Welcome to the Senior Hour, which is sponsored by Comfort Keepers in Home Care and Providence Holy Cross Medical Center. I'm Barbara Cochran with my co-host,
Jen Sparks,
on your hometown station, 98.1 FM, AM 1220 KHTS. This is a show for, about, and by seniors, giving information to enhance one's quality of life. And our first guest this afternoon, I keep forgetting that.
It goes quickly.
Time flies, doesn't it? It's Susie Riggs of BioRecharge. Welcome. It's good to see you again.
Hi, good to see you again.
Yes.
It's always so nice to come and visit you guys.
And tell us, what is BioRecharge?
BioRecharge is a wellness center that we have here locally in Santa Clarita. And at the heart of our system is something called the energy enhancement system, and it recharges your cells for overall well-being. So it creates the perfect environment for self-healing is what it does. And that's kind of at the heart. We do a lot of other things, but that's the basics.
So what does that include?
So that includes what is specifically, if you're going to come in for just an energy enhancement system session, it's the easiest therapy you've ever done. You come in, you bring a blanket, something that's going to make you feel cozy and comfy, eye mask if you have one, or we can provide one, some water to drink, and you just come in and you chill out on a recliner and you take a nap for 2 hours. It's a 2-hour visit. There's nothing touching, there's nothing attached. It's the energy environment in the room that is so special.
Well, so what makes you fall asleep?
So there are theta frequencies. Now, theta frequencies are it's that frequency right before you go to sleep. It kind of makes you sort of groggy. So that's already running through the room. So when you go in there, it's a very relaxed, zen kind of environment. It's amazing for all things relaxation. It's the perfect self-care environment, but yeah, it's quiet. There's nobody talking, chit-chatting. It's very quiet, serene environment. So, and then that theta frequencies makes you sleepy. So the people who say, I can't sleep during the day, many times they will fall asleep during the day. And then they're just surprised. They're like, wait, how did I do that? Well, first of all, part of the problem is that what people don't realize is that our brains never stop. They're just, especially now, it's like, constantly bombarded with information. When we actually allow our bodies to sit still for a minute in an environment that's calming. Also, there's frequencies that are running through there that help our nervous system calm down. So when that nervous system gets the theta brain waves and then it gets the perfect balance, the body just kind of goes, oh, whoa, I haven't felt this in so long, because we don't permit ourselves to sit still anymore. So that stillness alone kind of creates that, I'm tired. You don't even realize, like, we're just running on full force, but behind the scenes, we're exhausted.
And you don't give yourself a chance to heal when you're not resting. Exactly. And I'm one of those people who cannot sleep during the day. I have to be sick or have only had, 3 or 4 hours of sleep the night before. I find it really difficult to turn my brain off. Mm-hmm. So it sounds like your environment that you've created at BioRecharge gives me that chance to kind of pushes me a little bit to just calm down, put your phone away, first of all, I think is the first step.
Huge. It's huge.
Unplug,
Yeah.
So when I'm trying to imagine what I would see as I walk in at BioRecharge, am I in an individual space, in a room, and am I sitting in a lounge chair, in a cot? What does it look like for me?
Great question. So I always tell people, welcome to the Matrix, because you walk in and there's 36 computer screens. So we've got 6 towers. It's the craziest looking environment. 6 towers of 6 computer screens within the room. All of those computer screens are running a program that's scrolling, so it's real colorful. Each one of the screens has colors that coordinate with our chakra points. And that is part of the therapy, is that color that's going on there, but it's scrolling. So, and it has what looks like hieroglyphics on the screen. Also, it scrolls fast, some of them scroll slow. There's all these different speeds. There's reasons for all that stuff. But people walk in there and they're like, what is happening in here? in it, that's what's creating that incredible hypercharged energy in there. So it's kind of a little shocking at first. Then you just come in, there's 3 recliners, a king bed, and a twin bed. The king bed is primarily used when we do overnights, when we've got guests that have got major things going on with them, like cancer or autoimmunes, things like that. We do encourage them to come do overnights. Those are 11 consecutive hours in that energy. Very, very, very powerful outcomes when they do those. So don't usually have people in the king bed during the day, but yeah, you just take a seat in comfortable, super comfortable recliners or the twin bed. If you're there for 4 hours or more, then you can have the twin bed. But yeah, usually right now there's only about 3 or 4 people in the room at a time.
Okay.
But the reason it's a shared environment is because everybody is bringing in their own energetic field. We're energy, bodies of energy. We know that our mitochondria produce energy, so we run off of energy. So we're bringing in our own energy, and the higher the energetic field is in there, the stronger it is. So actually more beneficial when there's more people in there. So we like, it's nice to have that extra people in there,
Well,
contributing.
I was shocked myself because normally when I sit in the chair, I'll turn the TV on and watch a show. Mm-hmm. And all of a sudden, I opened my eyes and I said, wait a minute, what happened? I fell asleep.
Yeah. Because we're all exhausted deep down. We're just exhausted. If we give our brain a chance to just shut down, if we stop feeding it the constant bombardment of information coming from our phone or from the TV, usually we'll kind of calm down, especially when the environment is encouraging you to calm down with the frequencies. All of a sudden you're like, oh man, I'm exhausted. And people pass out. The people who say, I can't possibly sleep during the day, it's typically because their brains never shut down long enough for the body to go, oh, okay, this feels good. Because we don't. And I'm guilty of the same thing. I am go, 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 go.
Yeah. It seems like a nice treat. Like you mentioned before, it really is self-care, and certainly you're helping to address deeper issues like illnesses and injuries and that kind of thing.
Exactly.
Can we talk a little bit about what you would treat? So, for example, my back is giving me a little trouble right now. I don't know what I did. I'll have to, try and figure that out. Maybe with Adam Laraway at Focus PT, and the two of you guys can help me through this.
Yeah, we love Adam.
So, is that something that would benefit from that? Just like a little pinch in my back? Or are we looking at overall? I've got a cold. I've got a flu.
It's not so much for cold and flu, because the very first thing, especially if you've been in the room for a while and you've already done the whole detoxing, if you've come consecutively for a while, then you can come in and just kind of get that immunity boost. But initially, our body, when we go in there, because it's recharging the cells, we're all walking around in a low energetic state. So when we go in there, the first thing the cells recognize this hyper healthy energy, and they absorb all that energy. It raises the electrical conductivity of each cell. Now that cell's got the electrical power that it needs, and it goes, well, what are we going to do now that we have this? Because we haven't seen the level of energy in our cells in years and years, decades probably. It goes, well, what held us back from having that really beautiful high charge? It's always toxins, always. We are living in a toxic soup. So it initiates, our body is the one that's initiating it. We're not forcing anything by giving it supplements and going, you should be doing this. No, it's the body that goes, oh, we got this energy. Let's start pushing out these toxins. So your body starts to release from the tissues, because our bodies hold toxins within the tissues, all the fatty tissues hold. That's where our body loves to store that stuff. Starts to push that out into the bloodstream. So that really is kind of giving your body a lot of work. So it's not ideal to come in a weakened state, because your body is going to do a lot of work while it's in there, and then for the next day or so afterwards, it's pushing all those toxins out. And one of the things that is required after our sessions is to do a detox bath at your own house. There's a recipe that's included as part of your session. So we're like, your session really isn't complete until you go home and you do that detox bath to get those toxins out. And the reason we use a detox bath is because we have to get them out through, there's so many toxins that are being released that the only efficient way to get it out is through the skin, which is our largest organ of elimination. So we use that bath, and that kind of completes the whole session. You do get the electrical charge while you're there, and then you remove the toxins while you're at home, and it gives the cells a much cleaner environment. So when they go to regenerate, they're now regenerating as healthier and healthier and healthier cells for every time you come. So it's not a one and done. I always try to clarify that with people. It's not a one and done. You know, it's taken you years to get to where we are as far as in that toxic soup that we have within our body. It's going to take a little bit of time to reverse that and to allow those cells to fully recharge and the environment to get fully clean. So immunity comes a little bit later after that massive detox that you do. But then at the same time, it is reducing inflammation. So it's actually great for all kinds of aches and pains. We actually had a client come in yesterday who came in exactly for what you're saying. He's like, I've got this massive pain in my back. And I actually didn't even put him in the EE room initially. I was like, you know what? We're going to just put you on the roll shaper. The roll shaper is our lymphatic and fascia massager, because it was my intuition that was just kind of telling him, I'm like, you are so tight right now that we need to release all that fascia, because the muscle isn't going to stretch. There's something holding it in place. It's out of place. So he did the roll shaper. We did a pain and inflammation gel that we carry at the center too. And he came in at a 10 and left at a 3. He's like,
Good
oh
Lord.
my gosh, what a huge difference. So on Friday, he's going to come back and he's going to do another roll shaper session, and then he's going to do an EE system. And he should be just, loving life at that point. So yeah, everybody's session is a little bit different. Like I said, the EE system's at the heart, but it's not the only thing we do.
Right.
So,
And
it's interesting because when I'm sitting in my chair and I want to get up and go someplace, I get up, get the walker, and go flying around. And my kid said, Mom, slow down, slow down. But my body wants to go, yeah.
that's good.
Well, that's what I'm thinking, but they're saying, slow down, slow down. And I'm thinking, why do I have to slow down?
They
I've
just
got
want
the
you to be
walker,
careful.
I've got something to hang on to. Mm-hmm. I won't do that with my walking sticks. That I won't do. It's too hard.
Be a little more cautious.
Because I can liable to get a stick stuck on a piece of furniture and down I go.
Yeah, we
And I don't wanna
definitely don't want to do that.
No, I do not want to fall. I've fallen once and I didn't like it. They took me to the hospital and oh geez, no.
And you know what? As people age, the regenerating process, the recovery process tends to be much slower. That's one of the things that the EE system really excels at, is helping people to regenerate and recover much faster. It's incredible for after surgery care, anytime that you've had, bones, even cuts. My dad had a really bad cut on his hand. He's 93 years old, and he did a job on his hand. And I was like, oh my gosh, that is going to take a month to recover. He did a couple overnights, and that thing was almost good as new within 7 or 8 days.
so
It
what
was unreal.
what other ways can seniors specifically benefit from your services at BioRecharge? Obviously, talking about
Yeah.
wound care,
Yes, wound
aches and
care,
pains.
inflammatory. It's incredible for reducing inflammation. Now, what causes inflammation? It's usually that toxic cellular environment, to be perfectly honest. It's because the cells just cannot regenerate in a healthy fashion anymore. So they're regenerating in kind of in a dysfunctional state. So if we can increase that energetic charge, you're going to feel more energized to begin with. And then everything just regenerates faster. So really what we do is deep cellular wellness. We're really focused on everything that we do is at a cellular level. And that's what the E-system thrives on. And that's kind of what we're working on, educating people, because we're all so used to symptom chasing that we're not focusing on, well, why? Why do you have that problem? And really, when you keep asking why, and you keep asking why, and you keep asking why, there's not much deeper than the cell. So, yeah, there's atoms, but, we haven't gotten there yet. But as far as the cell goes, we just need to have better cell care. We need to take care of our cells individually. If we take care of them, boy, they're going to give and thrive, and then everything upstream just starts functioning better.
It's a domino effect.
Exactly.
Yeah, just the
It's
same as why is
incredible.
your hip hurting? Well, your knee is causing problems, so you're overcompensating and
Exactly. We're
keeps going.
connected.
Yeah.
Everything is connected. So instead of focusing on I know that Western medicine doesn't go there. It's all about the symptoms, but we're literally the opposite. We'll listen to your story and what's going on, but really, there's nobody that can't benefit from higher cellular energy and a detox, because everything in the body functions better when you do that.
Well, and it's treating symptoms, like you said, with Western medicine, just by, here, take this pill, take this supplement.
Right.
Instead
Masking.
of, getting at it in a holistic way.
Exactly.
Which I think is intelligent to address it that way.
Yeah.
You know?
Yeah, exactly. The masking, people don't understand. They're not fixing anything. They're masking it.
Sure.
And the disease is still thriving below. You're just not getting the symptoms. So people have this false idea that things are better. And in reality, nothing has been solved. And it's getting worse and worse and worse. And that's why you end up with multiple medications down the road, because the original thing never really was solved. And it started to spread to other systems within the body. And that's how you end up on 10 different medications. So, yeah, you got to start working on that foundational level. So that's really what we really, really push all the time, getting to the foundation. So you don't have to get on crazy amounts of medication.
Right.
So being proactive, hopefully, I really would like to see more people be more proactive. Don't wait till something is happening.
Yeah.
Come in, clear out that cellular environment, do some detoxing, and then guess what? You're not likely going to be affected by disease because you did everything that needed to be done
have a
at that
healthy
foundational
base.
level.
Yeah.
Exactly. That's
And
a
you can
perfect way to
start
put
with
it.
just a few sessions and work with them as they go along to see if they need more, what would benefit them the most, from your overnight options to just come in for an hour, 2 hours. Is
2
that
hours. Yeah,
Okay.
2 hours is the minimum, but you can start if you're just being proactive, then you
Yeah.
don't have to come in a lot. When we've got people who've got a lot of ailments, well, they're having to go, full force. They're having to do a lot of hours in a month because we're trying to catch up versus catch it before. So that's the difference. We have all kinds of clients. People come in young because they recognize the need to have a healthier environment, cellular environment. They just want to age gracefully. So much of what we're dealing with, we have doctors say it all the time, well, you're just getting older. Well, yeah, you are getting older, but why is your body functioning the way it's functioning? It's because
It's slowing down.
it's slowing down. But why is it slowing down? Really, at the core of it, it's slowing down because it doesn't have enough energy for all of the systems upstream to function properly anymore. It's that energetic charge that reduces. Our ideal cellular charge is 70 to 90 millivolts. But as we age, that reduces and reduces and reduces. Well, guess what? All the systems upstream are now trying to function at a very low energetic charge too. So it's kind of a different way of thinking of things.
Well, I know so many people who are my age who are just
Oh, right.
like this.
Yeah, I know. It's so sad.
It really is. And I'm thinking, how did that happen? But I've always been a positive person. I've always wanted to do stuff.
Yeah.
No matter what.
Mindset is huge. Yeah.
And I think that's what's kept me going and kept me alive, because both of my parents passed away when they were 70.
Oh, wow. So
And
you don't have that longevity gene necessarily. You just
no, but
you broke out.
They lived in England, and during the Second World War, and things just happened.
Right. Yeah,
and they
that's
weren't able
difficult.
to take good care of themselves. But I was lucky. My dad brought us over here when I was 10 and a half.
Wow.
And I've had a fantastic life. I really have. I've had my ups and downs, and the
Don't we all?
downs weren't
Yep.
very pleasant, but, you live.
Exactly.
You think, okay, tomorrow's a better day. And that's what my dad always told me. He said, stay positive. Think for the next day.
Yeah.
You're going to go for the next day. And
Makes
that's
a big
what I've always
difference.
done.
Yeah.
And my brother was
Absolutely.
the opposite. He was always like this. He was like my mother,
Yeah.
depressed.
Yeah.
Yeah.
And he
That's
passed
tough.
away at a very young age. He really did.
Yeah. Well, if you're feeling down in the dumps, you can go see Susie over at BioRecharge and kind of boost you up a little bit.
Yep.
At least put you in a better mood, if anything.
At a
little bit of
minimum.
downtime for
At a
yourself.
minimum.
Yeah.
Susie, how do we get a hold of you at BioRecharge?
You can call us at 661-727-7273, or you can visit biorecharge.net.
And where are you guys located, real quick?
We're here in Newhall. We're just about a mile from here.
All right, great. Thank you so much, Susie Riggs of BioRecharge. We need to take a break. You're listening to the Senior Hour. I'm Jen Sparks with Barbara Cochran on your hometown station, 98.1 FM and AM 1220 KHTS.
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host
Jen Sparks.
on your hometown station, 98.1 FM, AM 1220 KHTS. And our guest now is Adam Laraway from Focus Physical Therapy. Long time no see.
Long time no see. How are you?
Fine. How are you?
I'm doing good. I'm doing good.
Good, good, good. Yeah, I have to come and see you and put my feet in that,
In the newbie?
in the newbie. There we go, the newbie. It was in my mind before I said it, and then it disappeared. That's what happens as you get older.
Right, yeah.
Your
right,
mind
exactly.
says, bye-bye, see you in a while. So what's on the agenda today?
Oh, I thought maybe we just talk about kind of a little bit about Focus Physical Therapy and kind of how it's a little different than a lot of the other clinics in town here, that we really focus on that quality of care, and you see the physical therapist every single time, which is what physical therapy is supposed to be. It's kind of frustrating. So many of PT practices just in America, not just here in Santa Clarita, they're trying to make ends meet and stuff like that. So they're seeing, their techs and stuff like that, seeing the patients, more often than the physical therapist. And that's really not how it's supposed to be. Number one, because you're not getting the expertise of a physical therapist.
Yes, the physical therapist has been to school and has been through other areas where he or she has gotten hold of the actual process.
Absolutely. And the techs are an integral part of the rehab process. They do help us out. But, it's really important that you're seeing the physical therapist every single visit, and in our clinic, you see the physical therapist for the entire hour,
Yes.
And, because we're constantly assessing, we do our evaluation when you first come in to see, and we get an idea from all of our testing that we do that we think we know what's going on. But, as your healing process, progresses, sometimes things change, and sometimes things maybe improve with what we initially addressed, but maybe another thing, comes up that is actually underlying the problem, and it's the job of the physical therapist to kind of figure that out. And if you're seeing a tech, they aren't going to know that, because most of the time they just have like a high school education and then kind of on-the-job training. So it's really important, that you're seeing the physical therapist when you are in physical therapy, so that, you are getting the best care possible. And that's really what we're trying to. That's why I started Focus 7 years ago, and really trying to carry out that mission.
Well, and you work hand in hand with the doctors. So
Yes.
it's a continuation of the injury or surgery that your patient just went through.
Absolutely.
You're a vital part of their healing.
Absolutely.
They can't just say, "Oh, you know what? I'm fine. The stitch is healed, and doctor said I was clear on his end."
Right.
This is a whole other
Yep.
process now.
Absolutely. And a lot of times that responsibility after the rehab process for surgery, or even just an injury, if you've fallen or you have something, you go and see the orthopedist or maybe your general practitioner, and it's funny because they'll say, like, you guys are the movement specialists. I'm sending them to you so that you know what to do. Like, I don't necessarily know what to do with them. The surgeons, more often than not, we're in communication with them. They may have a protocol for the post-surgical program that they want. They have certain kind of parameters that we can kind of perform it within. But it's really important that you're getting that constant one-on-one attention, and you're seeing the physical therapist.
And you're staying with that physical therapist
Yep.
until the problem is solved.
Exactly. Yep.
And that's critical.
Yep.
That's very, very important.
Yep. And sometimes, I mean, we do sometimes discharge people when they're, say 80 or 90% better, but we also give them a home program so that they can continue to do those exercises on their own. And it's funny, if I do that, I'll say, okay, give it, 4 to 6 weeks, and then, give me a call, let me know, how things are going. Do we need to get you back in? Are you doing okay? And the ones that do call usually be like, everything's good. I don't need to come back in, but I just wanted to follow up with you. So, having that communication and that relationship with the patient is really, really important, so that we are getting you back to full recovery and back to doing what you want to do. It's really, really important.
Yeah, it is. It is. It's very important.
Yeah. And we do have one other kind of aspect. So, in the physical therapy profession, we have kind of three, I guess, defining professionals, if you will. We have the physical therapist, we have physical therapy assistants. Physical therapy assistant is a 2-year degree. They go to school as well, and they learn how to do all the treatments and stuff like that, but they don't necessarily learn how to do the evaluation. So we have a physical therapy assistant in our clinic. Her name is Emma. She's wonderful.
Yes.
And so she can do the treatments, but she can't do the initial evaluation. So she goes on the cueing that we give her when we write up the initial evaluation of what we want to do and what treatments we want to carry out. And then she's skilled with her 2-year degree, and she has to actually sit for the boards and get a license and maintain it and do continuing education. Versus a tech, or an aide, they don't have any clinical training or any credentialing or anything like that.
So Emma is continuing her education
She
to become
because
a physical therapist.
she's a physical therapy assistant. Let me back up a little bit. So we have to keep our license every 2 years. So my license renewal is in March, and so every 2 years we have to do I think it's 32 hours. I have to remember now because I used to have my Oregon license as well. But we have to do 32 hours of continuing education. I actually think it's 36 with CPR. So we have, education that we have to do every 2 years to keep our license, just to make sure that we're up,
Whoa.
on current trends and that type of
32
stuff.
hours that's a long time.
Yeah, I mean, if we go to a course, usually that's a 2-day course, so we're getting usually 16 hours, 2 8-hour days, so you're going to a couple courses a year. And it's good. I think it's important, because technologies change, research changes, and we want to stay up on that. Now, having practiced 26 years, and then I've got, 3 other therapists in my clinic that are newer graduates in the last 4 years, it's kind of funny because things have changed. They will ask me a question, and there's been a couple times where I'm like, I don't know what that is. I had to go look it up, and so there's that, clinical experience of, I've treated for 26 years. I've seen a lot of different things. I know, good kind of patterns of, how patients present and what things are going. But then there's, obviously some new stuff that they're teaching in school that it's been 26 years since I've been in school. So,
So does that apply to something like the newbie, where it's pardon the pun, new technology?
yeah.
That you're able to use, based off of your book knowledge, if
Right.
you will, and
Yeah.
then now you have this new technology, and,
Yep.
and you can kind of sandwich those together. Are
Absolutely.
you seeing a lot of development with something like the newbie or something similar to that?
Yeah, I mean, there's constantly new technology that's coming out, and so trying to keep up on that. I'm actually been kind of reviewing another piece of equipment called the Winback that I've been looking at. That's pretty interesting stuff. It's what's called Takar therapy, and it works a little differently. I'm still trying to kind of understand.
therapy?
Takar,
Oh,
Tecar, yeah.
Takar. I thought you said car
It was, I
therapy,
think,
and I'm
developed
thinking,
over in
what?
Europe, and it's
Getting
now
in and out of cars?
right.
Whoops.
Yeah, so I'm still doing a lot of research on it. I'm not quite sure I'm versed well enough to discuss it yet, but it's definitely something that's interesting to me as another kind of up and coming technology that helps with tissue healing and that type of stuff. But the newbie is definitely that way. I mean, if you just were to go buy a newbie off the shelf and try and, treat with it, it would be very, very difficult to know what to do with it and that type of stuff.
That wouldn't even cross my mind.
Yeah.
I would want an expert like
Yeah.
yourself,
Well, and-
or Emma, your
Yeah.
team there at
Yeah.
Focus Physical Therapy, who know what they're doing.
Yeah,
and,
for sure. And it is a class 2 medical device, so you have to have a medical license to be able to treat with it. So
Yeah.
you can't just go buy it off the shelf. But I know because I'm actually one of the clinical instructors for NewFit, and so clinicians can come to my practice to learn how to use it.
This new one that's coming out.
No,
Oh,
the
the
newbie,
newbie,
the
the
newbie, yeah,
newbie. Oh,
yeah. So I've
okay.
had a couple people. I had somebody from Nevada come. I had somebody from San Diego come. So they've come and then they spend the day with me and I train. And there's also different trainings you can I flew to Austin and I've done different trainings over there for like 4 days at a time. And then I went to Florida for some training in it. So it's a lot of training to really get versed on how to treat with it and be effective with it.
We're talking with Adam Laraway of Focus Physical Therapy here in Newhall. Adam, can you talk a little bit about with and for Barbara what you do specifically with the newbie? You said you've got to go stick your feet
Oh, yes.
in the
That's-
newbie
that's
and it'll help with aching and pain and you have arthritis I know that you deal with
Yes.
as well. Can you talk a little bit about that?
That's mainly what it is, but it's also neuropathy, which comes from the medication.
Yep.
At least they're thinking that.
Yeah, the side effects from the medication.
From the methotrexate that I took.
Yep.
And I took that for 6 years.
Yep.
And then for 4 months I was off it. And that's when oh my goodness, my feet went nuts.
Yep.
Absolutely nuts.
Yep.
And that's when I came in to see you because you were on the show.
Yep.
And you were talking about the newbie, and I
Yep.
thought,
Let's try
that
it out.
sounds interesting. Let's try it
Advertising
out.
works.
That's right, absolutely.
Oh, yeah, and it really does. It
Yeah.
works. And
Yeah.
I have to come back in again.
Yep.
So
because
how
it's-
often do you treat
Well,
for that?
I haven't treated for several months now
Yeah.
because everything was fine.
Yeah.
Yeah.
Yeah. Everything was
You
doing
know,
good.
everything was good.
Yeah.
I was not having any problems. No numbness, no tingling, and I'm thinking, wow, that was incredible. But now, over the last must be at least 4 or 5 months
Yeah.
since I've been
It's starting,
in there,
yeah, it's starting to come back
and now
again.
it's beginning to come back.
Yeah.
So is
I can feel it now?
Is that based on Barbara's aging like we all are and so now she just has different needs?
Not necessarily. I mean, peripheral neuropathy is a really challenging diagnosis to treat because, the nervous system has kind of gone haywire, so to speak. And there really, unfortunately, is not many good treatments for it. They use some medications, and I would say it takes the edge off. Gabapentin
Yes.
and Lyrica. Yep.
That's the one I use, gabapentin.
Yeah, and it takes the edge off, I would say. I mean, it does
Yes,
help, but
it
it definitely
does.
doesn't make it go away.
No, does not
and
make
one of
it
the
go away,
cool
and
things.
it's worse at night.
Yeah, for sure. But one of the cool things is NewFit actually published a study last June that looked at peripheral neuropathy, and they did a very specific kind of criteria to be included in the study, so that it wasn't just numbness and tingling; it was specifically peripheral neuropathy. And they were able to show within about 12 sessions. They did the foot bath, which is what you were referencing at the top of the show, where we stick your foot in a bucket of water, and then we stick the newbie, which is electricity. We stick one of the pads on you and then one of the pads in the water, and we electrify the water, which I know sounds kind of funny.
Sounds
You're
way
like,
crazier than
right?
it is, I'm sure.
No, but it's an incredible
Yeah.
feeling, though.
Yeah,
It really is.
Yep.
It's a healing feeling,
For sure.
if that makes any
Yeah.
sense.
yeah,
Is it like do you feel a vibration?
Yeah, yeah, you do. But it's not a painful vibration. It's a soothing vibration.
yep,
It makes you, something's happening,
yep.
but it's not flying you
Right.
off in the air,
Yeah,
like
And
you're
not
like
making your hair stand up on
Bugs
end.
Yeah.
Bunny cartoon, yeah.
Yeah, yeah. And then we also use it. We use it a lot of different ways. We also use there's a glove that we put on our hand,
Yes.
and then we put an electrode on you, and then our glove becomes basically the other electrode. So we can use that and do kind of a massage, if you will,
Yeah.
to kind of work through different tissues and that type of stuff.
Yeah, I've been through that, all of that.
Yep.
I've got to come back and do it again now.
Yep.
Yeah.
So and it
But-
may have been, we were healing things when we saw you 4 or 5 months ago, and things got better. Your symptoms got better, but maybe we didn't quite heal it 100%.
Well,
and that's why it kind of
that's why
slowly
it's
kind of
coming
came back.
I
Yeah.
bet you that's what it is.
Yep. So,
bet
because
it
those
is.
nerves, they gotta completely heal, and so when I was talking about earlier with that study, it was really cool because some of the criteria that they looked as far as of how to quantify whether the improvement was, obviously the patient feedback was part of it, but they did what's called the nerve conduction velocity. So it's one of the kind of gold standards for checking for like neuropathy in nerves, where like carpal tunnel, or there's another one in the foot called tarsal tunnel. What they'll do is they'll stick a needle in the nerve at say one point, and then they'll do another point on the body, and then they send an electrical charge from point A to point B.
Oh,
And we know how fast a nerve should conduct from point A to point B. And so when we do that in your nervous system, if the signal isn't getting there as quickly as it should, we know that there's what's called latency, and then that tells us that there's some trauma to the nerve, and that's what we're trying to heal. And so the study with the newbie, which was really, really exciting, was it actually showed the improvement in the nerve conduction velocity. So here's an objective test that we could do the treatment with the newbie, and then we retested it, and it showed that we had significant improvement. So we knew that, it wasn't just a sham, treatment. It was actually improving the conductivity of the nerve, which is what's going to get rid of that peripheral neuropathy.
Now, do I have to have another prescription for that, or am I still
Probably,
covered
yeah,
with
because
yours?
if it's been more than 90 days, then yeah, you just got to have your doctor send a prescription over.
Okay.
So for sure.
Okay.
Yeah.
Yeah, that's what I'll do, because I see the doctor.
Okay.
I think, is it today? I don't remember
Yeah.
anymore.
Yeah. With
You know,
Medicare,
as you
we
get older,
yeah.
your mind says, bye-bye,
Yeah.
see you in a while.
with Medicare, we have to do what's called a plan of care every 90 days or
Every
10
90
visits,
days.
and so you do have to have that be under the care of the physician. Although there is some talk in legislation that they may do away with that soon, so that would be great, and then we would be
Oh, it
considered
would
more like a
be.
primary
Oh,
care
good
physician, which
heavens.
would be great.
Oh, yeah,
Yeah.
it really would.
Yep.
It would make a big difference.
Absolutely.
Wow. Well, do we need to take a break?
We sure
I think we do.
Yes, we're going to take a.
Yes.
We're talking with Adam Laraway of Focus PT. You're listening to the Senior Hour. I'm your host, Jen Sparks, and Barbara Cochran will be back in just a moment.
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Jennifer Sparks, on your hometown station, 98.1 FM, AM 1220 KHTS. And we're speaking with Adam Laraway of Focus Physical Therapy. And we were talking a little bit about the newbie. Mm-hmm. Can we continue?
Yeah. You'd kind of asked me during the break to talk about kind of where the newbie came from, and how long it's been around. So the newbie was developed in 2017, so it's been around almost 9 years now. The cool thing that makes the newbie different than a lot of the other treatments that physical therapists or other fields will use is that it's direct current. So most people, if they've been to therapy, they've experienced some electrical stim with what's called alternating current. So if you've seen like a TENS unit, or there's another one called interferential, there's quite a host of different ones that we can use in the clinic. But what it makes those so different is they're alternating current, meaning that the current is going back and forth. Okay, and with the newbie, it's direct current, and direct current has been around forever. But unfortunately, there was not a good way to get the direct current into the system because it burned the skin. It caused your muscles to like fully contract and was uncomfortable. And it wasn't very useful. When somebody has, say, like a fusion surgery or has a bone that has broken and won't heal well, they'll use a bone stimulator, and that is using direct current, but it's using kind of the old form of direct current. So when people get those bone stimulators, they have to wear them for, like 6-8 hours a day. It's at a very low intensity to make it tolerable, but it stimulates the bone to heal, to fuse. So direct current has these really cool properties to get our bodies to heal, and it works along with your nervous system because it's not a stressor to the nervous system because it just mimics it, if you will. And so Garrett Salpeter is the owner of the NewFit and Newbie equipment. He's the one that developed it and played around with it for I think about 10 years before he got it right.
Wow.
And then it got FDA clearance in 2017, and it's been just a whirlwind since then with getting practitioners to utilize it into physical therapy clinics and chiropractic clinics and that type of stuff, and figuring out how to use it correctly and getting tissues to heal. But we have seen so many miraculous recoveries has just been amazing from, there's probably NewFit's most famous one is a woman named Amy that was a quadriplegic for 25 years, and she's now walking again, which is just amazing.
That is amazing.
Yeah. So pretty cool stuff. I've had a couple of those aha moments with myself. I've had a couple patients with paralysis, whether it be just an arm or something like that, and we've gotten function back. So pretty cool stuff. Pretty cool stuff.
Well, I can certainly speak to the newbie because it's really helped me.
Yeah.
And I quit because I was healed, I didn't have any more neuropathy, and
Yeah.
my feet didn't tingle, they didn't get numb, and I was so happy.
Yep.
But that's been quite a few months ago.
Yep. Yep.
And that numbness and tingling has come back.
Yep. Yep.
I can feel it coming back now, especially at night. So I need to come back and go see the newbie.
That's right. We'll get
Meet
you
the newbie again.
Get you fixed back up for sure. Yeah.
Well, it sounds like you can use it not as a supplement, but as you feel
As
like,
a
okay,
healer.
yeah, just stay on top of it.
Yes.
Don't let time lapse without going to see Adam at
For sure. Yep.
taking
That's
care
what
of
I'm
it.
going to have to start doing is just, maybe not go every week or
Yeah.
whatever, but maybe every other week
Yeah.
or every 3 weeks.
Try and
or,
be consistent with it.
Yes.
It's part of your, routine.
Yeah.
Yes, part of my life.
Yep.
Yeah.
Absolutely.
Yeah,
Absolutely.
especially if it's so beneficial and it works, and you
right.
appreciate the, guinea pigs
Absolutely, yeah.
before everyone to figure out that this device is effective.
Yeah.
Oh, and it is.
It is,
Believe me,
yeah.
it is.
That's-
I can stand up and cheer for it.
It's kind of funny. I'll tell you a real quick story. But I was playing golf like the day before New Year's, and it was cold and windy. Was when the rain was coming, and I don't know what happened, but the 17th hole, I went and swung, and my back locked up. And I have a history of a disc herniation that happened back in 2008, but I'm completely healed from it. So I don't know if that was what it was, but something in my back locked up. And so I got home, and when I got out of the car, like I could barely stand up straight. Everything just tightened up and all that
Whoa.
type of stuff. So I got on the newbie, and I mapped things up and got moving, and by the next day it was gone. Actually during the workout it was actually probably 80% better. So if you tap into that nervous system and you can get the nervous system to work correctly, you can get rid of that pain pretty quick, which
That's
is
incredible.
yeah.
I got to come see you.
And you can find that wonderful device, the Newbie, with Adam Laraway at Focus PT. Adam, can you give us your info on how they can get a hold of you?
You bet. So we're located at 25050 Peachland Avenue, Suite 205. Our phone number is 661-255-4205. And our website is www.focusptscv.com.
Perfect. Barbara, quickly, we're sponsored by
Comfort Keepers Income Hair and Providence Holy Cross Medical Center. Now go and enhance your quality of life.